One. Hello and welcome to our discussion with leaders from UT Health. I'm Jimmy Holmes, President and Publisher of the San Antonio Business Journal. Today we're going to talk about the new Cancer Quest and how UT Health is driving the future of research and treatment and what it means for San Antonio's economy. Today's objective is for one, to discuss what is driving value in cancer care, and two, to determine how UT Health is integrating better patient care and research. And three, we will learn how this can also translate into economic growth and create lasting impact in our community. Before we get started, I wanted to first thank our panelists for taking time out of their busy schedule to discuss this extremely important topic. Now let's begin with some introductions. Here to help me set the stage is Dr. Ruben Mesa. Dr. Mesa, please tell us a little bit about yourself and introduce your colleagues here today with us.
So I'm Ruben Mesa. I'm the Executive Director of the Mays Cancer Center at UT Health, San Antonio MD Anderson. I'm a hematologist, a leukemia specialist who focuses on new drug development. Been here about 5 years. It's a wonderful place. Love San Antonio. And joined by fabulous colleagues here on the panel today, Dr. Kate Lathrop, who is one of our medical oncologists who focuses on breast cancer. Kate, why don't you tell them a word or two about yourself?
Sure. Thanks, Dr. Mesa, and thank you for having us. As Dr. Mesa mentioned, I'm a breast medical oncologist, so I treat majority women, few men, with breast cancer. And I'm a native of San Antonio, grew up here, went away for undergrad, and then came back and did my training here and was lucky enough to stay on as faculty. I'm also involved in education here at the university.
Wonderful. And additionally, Dr. Mark Bonnen, who is both our chair of radiation oncology, but also the chief medical officer of the Mays Cancer Center. Mark, why don't you share a word or two about yourself?
Well, thank you, Ruben. I'm Mark Bonnen, as Ruben said, and I'm the chair of radiation oncology and the chief medical officer. I focus on the treatment of breast cancers, as well as brachytherapy within the realm of radiation oncology. Additionally, in my role as the chief medical officer, I'm responsible for identifying ways to enhance care, make care safer, make care more seamless for our patients. And I'm really delighted to be here in San Antonio. I moved over from Houston about 2.5 years ago. So great to be here.
All right. Well, my first questions are directed back at you, Dr. Mesa. Give us some background on the Mays Cancer Center.
So the Mays Cancer Center has a really deep history. It started as a cancer center back in 1974. So it really was one of the first cancer centers after the war on cancer was declared in 1971, where individuals across San Antonio and around the country came here who were focusing on new therapy development, on breast cancer, new forms of radiation therapy, surgery to create what at first was called the CTRC, or Cancer Therapy Research Center. It has been a National Cancer Institute designated cancer center since 1991 and has as its focus the community of San Antonio and South Texas. So we view our community to be the 4.9 million individuals in the 38 counties of San Antonio and South Texas. And our mission is to really decrease the burden of cancer across our whole region in San Antonio and South Texas and beyond through our efforts in clearly cancer care and practice, but also through research and education, training that next generation of cancer physicians, nurses, and scientists.
What types of research will expand here at Mays Cancer Center to better meet the health demands of the region?
We view our goals in research to really be very broad. The journey in cancer is very broad. We focus on 4 key areas. The first is understanding the biology of cancer. Why does it occur? Why does it develop? Why does it progress? And we look at that really through a South Texas lens. There are certain cancers that are more common in our area, such as liver cancer is probably the most overrepresented cancer for our region. Well, why is that the case? Can we prevent it or screen it in a more effective way? So first, South Texas-focused cancer discovery. Second, advancing the science of cancer in Latinos. Our community is 69% Latino, and we care deeply about the whole region, and around the Rio Grande Valley, those rates are almost at 90%. So how does culture, ethnicity, race, challenges in terms of social determinants of health. How do these impact the whole cancer journey, whether it be in prevention, whether it be in screening or predisposition, the efficacy or effectiveness of therapies that we have, and even survivorship. And then finally, we focus on both the development of new therapies. We have significant efforts developing new therapies, whether they be the first testing of new agents, whether they be using the immune system or new medicines to treat cancers, new forms or more effective ways of delivering radiation therapy, new surgical techniques. How do we advance new therapies? And then how do we deliver that complex cancer care in a patient-centered way? So we study that whole range of topics with the singular purpose of trying to decrease burden of cancer in our community.
Can you tell us a little bit about the research funding dollars for programs that impact our region?
So we receive over $50 million in what we call peer-reviewed research funding. These come from a range of different sources that our investigators compete for, and it's a very, very competitive process. First, from the National Cancer Institute, our NCI designation is in fact recognition of a very specific grant. That's a very competitive grant called the Cancer Center Support Grant, of which there are 71 such centers in the U.S., just 4 in the state of Texas, but we are the only one for this region. Second, we certainly are deeply grateful to the support that we receive, again in a competitive fashion, from CPRIT, the Cancer Prevention Research Institute of Texas. This is a very unique resource for Texas. Other states deeply wish that they had such resources available. That's a second critical piece. Then, without question, many additional grants that are received from individual disease-related funding sources, other national organizations such as the American Cancer Society, Leukemia and Lymphoma Society. And then critically, we receive a tremendous amount of support both from the community of San Antonio. We have many individuals that are deeply dedicated to the mission in cancer, and they play a critical role helping us both recruit talented new scientists and clinicians to our region, as well as help to provide critical pilot funds to take ideas and have them be initially tested.
What makes Mays Cancer Center the leader in Latino cancer research, and why is that important for the future of cancer care?
Advancing the science of cancer in Latinos is critical for us because that is our community. And as one of the only minority-majority focused cancer centers, we're in a very unique position to do so. We're the leaders in part because it's been a strong area of focus, and we've had amazing investigators here that have brought their talents to really make a difference. People like Dr. Emily Ramirez, who is internationally recognized as a leader in this area, and many individuals like Dr. Ramirez focusing on this. We bring to this community every 2 years a meeting which we developed called the Advancing the Science of Cancer in Latinos meeting, where we discuss all issues related to cancer development, prevention, screening, therapy, and survivorship in Latinos with cancer. We've learned that Latinos are not just one singular group by any means, that there are many differences in terms of experiences, race, ethnicity, and genetics, which matter. So here clearly in South Texas, we have many individuals who are of Mexican heritage, but with significant additional experiences and genetic influences from Europe and others over the 300 plus years that this has been a very active area. We know that can be very distinct from, let's say, the Latino experience in South Florida or in California or in Arizona or the Southwest or in other parts of the country. So we do research in collaboration with other centers to compare and contrast. So for example, we have a significant National Cancer Institute grant led by Dr. Emily Ramirez that is done in partnership with the University of Miami, where we are studying 3,000 cancer survivors who are Latinos, comparing the 1,500 from South Texas with 1,500 from South Florida, and learning similarities and differences.
Okay. Well, thank you, Dr. Mesa. My next couple of questions are for Dr. Kate Lathrop. What is the value of having a National Cancer Institute designated cancer center that serves San Antonio and South Texas?
Well, I think when you ask the question, what is the value? I think you can define value in a lot of different ways. From my perspective, mainly as a physician treating women with breast cancer in our community, but also as somebody who grew up in San Antonio, it's part of the community. My family lives here, and I'm an alumni of the university here, the medical school and the residency program. I think I see that value in a few ways. One would be obviously the value of having high quality, integrated, compassionate care close. As my parents age, as my friends' parents age, we get more and more of the calls of, do you know somebody who can do this and needs that connection. And having those really high quality physicians and care teams down the street is really important, as opposed to having to travel outside of your community for that care. So I think that represents a lot of value to our community to have these resources here. I also think for value, from my perspective, is educating our community. And that comes in both educating our potential patients about, as things Dr. Mesa mentioned, prevention, care, screening, but also educating the potential future workforce in San Antonio and South Texas. We collaborate with lots of other local universities, high schools, to try to bring in new learners into the healthcare system. So as Dr. Mesa mentioned, we care for a high percentage of Latinos, and we know from research that patients do better when their doctors and their nurses and their care team are more like them, that they can connect to them. So it's also just as important to bring that community in to serve as the future healthcare providers in our community. So reaching out to populations that maybe have been underserved in medical schools is really important to us. Getting those students who may not see themselves as a traditional researcher into research and showing them the value of that to their career and how passionate they can be about that, and diversifying that workforce too. I think that is a significant value that sometimes isn't quite seen as highly as the patient care.
And Jimmy, perhaps I'll add one more thing, and I think Kate highlighted several key aspects of that. But let me add just a couple others that I think might be really of interest to the readers of the San Antonio Business Journal. So first, without question, the uniqueness of some of the care capabilities that an NCI Cancer Center has is very important. This is really a network of the leading cancer centers across the United States. And as a distinction that institutions have spent, significant amount of time, energy, and resources to be able to achieve. University of Miami, I think, which is the most recent addition, invested almost $200 million to be able to grow the program to achieve that distinction. So it's a very critical distinction. But the first is that the uniqueness and the quality of that care, particularly with a base of clinical trials that allow the most cutting-edge capabilities for care so people don't have to leave home to receive care, is critical. Now, what that means for your readers is that as companies really look at San Antonio, either to remain as their headquarters or bring business here, or to expand to San Antonio, they know that both they themselves and their employees will really have access to world-class cancer care where they don't have to leave the community to receive that care, which is really critical. The second is the ability to really grow the economy through the individuals and the science that we help develop and the people we recruit. So, for example, we've helped to recruit individuals that are really leaders in drug development, that help to grow our economy, both through the grant funding that they're able to bring, but these people bring many people who work with them. These are all highly educated types of positions, but then they have again, spin-off companies, and other development that really arises from all of those efforts. So it really acts as a very strong economic engine in many levels. It supports the rest of the growth of the economy, but it directly helps to grow the economy as well.
Is there another level to designation, or is this NCI designation it? Is there?
So there is a second level that we are striving for, that is to be an NCI comprehensive cancer center.
Okay.
We go in for our next renewal, which we could compete for that in September of 2024. We are very excited to be on that journey. We have been growing our faculty, our research to a significant degree with great success and support from CPRIT, from the community, as well as really the growth in our institution and our cancer focus. The development of our new cancer-focused UT Health Multi-Specialty Research Hospital will be a critical piece of that, with unique capabilities, both in terms of care, new program development in cellular and stem cell therapies, as well as the ability to have a complex inpatient cancer clinical trials that are not largely available in our community.
Okay, thank you. Dr. Lathrop, what's the value of having the Mays Cancer Center, and what research to connect? How do you decide what to focus on?
So the way that we decide which research projects we really want to invest time and money and effort in is complex. And it tends to be broken down by what we call site teams. So different groups of physicians, as Dr. Mesa mentioned, specialize in different things at the cancer center. So, for example, we'll have a group that really specializes in breast, or we'll have a group that specializes in certain types of blood cancers. So because the research we do can be so specific to different types of cancer, we have groups that can look through different projects and really be critical about whether this one is something that we're interested in, something that serves our community. And so that's where it really starts, is in these small groups. And what I think is special about that, and really highlights what an NCI designated cancer center can do, is that where that usually starts is a conversation between people who majority work in labs and people who majority work in the clinic. And they come together and they sit in the same room and they talk about these things. And we refer to that as translational research, where you're really trying to take things from the lab to the clinic, from the clinic back to the lab, because that's where discoveries really are made in cancer. And those are really highly valued by the National Cancer Institute and supported by our grants from them. The other thing we do, which I think is important, is that we participate in large clinical trial networks. There's multiple of these, but we, as part of an NCI designated cancer center, are members. And so larger trials that would be very difficult to do in individual centers are done across the United States, or even done across the world. And we have investigators here that run some of those trials. And we can give you examples if it would be helpful.
Yeah, well, talk about some of the successes in those research efforts.
Sure. I'd like to highlight one that we're doing currently in breast, which is a collaboration between neurosurgeons, medical oncologists like myself, radiation oncologists like Dr. Bonnen. There's a group of patients with breast cancer who develop disease that travels to the brain, which is called metastatic disease to the brain. And those patients traditionally have done very poorly, unfortunately. And in the past, because their prognosis was so poor, we specifically did not want them on clinical trials. We would say, you can't be on trials because you have such a poor prognosis. In recent years, with some of the efforts, particularly with Andrew Brenner, who's the primary investigator here, we've switched that and we said, no, because these patients do so poorly, that's who we should really focus on. And so we're bringing drugs that otherwise wouldn't be available to those patients and giving those medicines before surgery, then they go to surgery, then they get more medicines and potentially radiation. So it's a real collaboration between multiple services to care for these patients. And as Dr. Mesa mentioned, that wouldn't be available outside of a clinical trial. And from a personal experience, we have lots of patients who are doing really well, so it's exciting.
How many drugs have been made out of this, that's come out of this research?
So as a center, we now have over 25 drugs that we've played a critical role in directly developing that are used in practice every day. Indeed, even just over this past year, the 2 different agents, we were playing a lead development role in the chronic leukemias that I treat have become FDA approved. One in November, ropegylated interferon alpha 2B, and one in just February, pacritinib, a JAK inhibitor for patients with myelofibrosis with low platelet counts. So the impact that this center has had has really been tremendous. And that legacy that started with us really being kind of first in human testing remains to this day. We have the Institute for Drug Development, led by Dr. Daruka Mahadevan, world-renowned expert in new drug development. That is a critical program for our region. Indeed, we have trials ongoing every day where the very first person on earth tested with the drug is here at this center. Indeed, at the end of last year, we were the first to test a new drug developed both by our dean, Dr. Rob Horomis, and colleagues that had developed a brand new type of drug that works against a specific vulnerability in cancer cells. And those exciting efforts are ongoing as we speak.
Okay. Dr. Lathrop, what do you believe is the greatest impact for research in our community?
Well, I think the greatest impact for research in our community has to be for the patients themselves. I know there's lots of other ways to define value, which Dr. Mesa's eloquently gone through, but when I finish this interview and go to clinic and I'm sitting across from women with breast cancer and they're potentially at the end of what's available, a trial is their lifeline for the time that they have left. And I think having the ability to offer a trial that you think can help a patient is of the greatest value. And I'd like to also mention that these patients provide a lot of time, effort. They dedicate a lot of their the time that they don't have a whole lot left sometimes to help us with these trials. It takes a lot for a patient to be on a clinical trial. And I think that also is important that it's close because it's often more visits, longer visits, more monitoring. And so the fact that they can do that and still be close to home makes it possible for a lot of these people. So I think the greatest value has to be with improving, the lives of our patients with cancer.
And it's improved the mortality rate as far as...
So we do know that patients on clinical trials do better. And it doesn't actually, it's not just on patients who receive new medicines, but any clinical trial helps patients live longer or feel better, have a better quality of life. And that has a lot to do with when a patient's on a clinical trial, their care team expands. It's not just me as their physician and maybe my primary nurse trying to help take care of them. Now they're a part of the whole research community at the Cancer Center. That brings in other highly skilled nurses monitoring them. It brings in the research staff that are watching the progression and looking over things and suggesting things. And so we know that patients who enroll and participate on clinical trials, they have better outcomes. So that, I'm not sure if that answered your question.
Oh, it did. Thank you. Now, Dr. Mark Bonnen, you've been patiently waiting. Thank you very much. What is the value or economic impact of providing a better continuum of care for cancer patients?
So it's a great question. If you look at what we spend as Americans on oncologic care, it's on the order of over 200 billion with a B annually, of which about 21 billion with a B is actual patient out-of-pocket expense. So you start imagining, exactly what this means to the individuals involved, to the patients, to their families, and then you add in this additional aspect of it, which is nobody wants to have an unnecessary ER visit. Nobody wants to be hospitalized unless it's absolutely necessary. Nobody wants additional procedures that aren't necessarily going to help improve their care. And finally, everyone wants the absolute best care that is most likely to give them the best chance at long-term survival and beating their cancer. And so when you start looking at the cost of cancer, those are all the elements that come in. So what are the things that drive that cost of cancer up? Well, the things I mentioned, unnecessary or duplicate procedures. This is when, if you don't have a coordinated care team, you may, one group of physicians may not know that this particular test was done and they'll repeat it. We see this frequently throughout the United States. Additionally, poor symptom control or supportive care, meaning that when a patient is exhibiting a side effect from their treatments, the team hasn't swooped in and given them the supportive medicines and care that would help prevent them from having to visit the ER or be hospitalized for that matter. And then, finally, something that we are very concerned with in the U.S. is what we call non-evidence-based care. So if you look at all cancers, what is evidence-based care? Well, if you took panels of experts from around the world that were knowledgeable in a particular type of cancer, 97% of the time they can come up with a very clear path forward for those specific cancers in that specific scenario. And what we're talking about when we say non-evidence-based care is that the care path that patients receive isn't necessarily consistent with that body of evidence that would confirm that they would have the best chance for long-term survival on, the given care path. So how do you impact that? That's sort of the challenge that we have here at Mays, and I'd say that this is what NCI cancer centers are all about, is we're providing that multidisciplinary team that Dr. Lathrop and Dr. Mesa were talking about. So this is a team of specialists from all disciplines who come together focusing on a specific disease site. And they, as Dr. Lathrop was mentioning, they do everything from considering what would be a great new area of research to what is the specific treatment, the best treatment path for this patient that's in front of us today. So these teams come together. We make every effort here at the Mays to see all patients up front. Each discipline sees each patient before they've received any type of care. They decide as a group collaboratively what would be the best care path for this specific patient, and then we move forward on that path. And so this enhances and addresses all those things that we were talking about, such as eliminating unnecessary procedures, decreasing ER visits, decreasing hospitalizations, making sure that the patient's getting the very best care plan that'll give them the very best chance of survival.
And Jimmy, if I could add one other piece that I think is increasingly in national discussions really being recognized. So there's first, as Mark had nicely laid out, the initial part of the journey. The diagnosis and treatment of the cancer and the significant expense, and hurdles to overcome in terms of, medical therapies, radiation therapy, surgical care, all of these different pieces. The second, though, is clearly the recognition of the significant impact on cancer survivors. Cancer survivors is going to be a very significant group of individuals in the U.S., and really in the tens of millions, which is wonderful on the one hand. It certainly is a reflection of the advances that we've made in cancer care. But it certainly shows us that what we do in terms of the healthcare for cancer survivors, as well as what we do during treatment, has an echo that really radiates through the rest of their lives. So we have brought together teams really focusing on this as a comprehensive medical university that has an NCI Cancer Center as a critical piece, but it's a matrix cancer center with all of these other resources. We've brought together specialists in rehabilitation, in the heart and cancer, cardio-oncology, in cancer in the kidney. We weave primary care physicians during the cancer journey, because sometimes that care is kind of dropped during cancer care. We weave together all of these parts to really try to ensure the health of the cancer survivor, really preserve their health, but also really help them to recover. And that has both impact, not only in terms of length of life and quality of life for the individual, but undoubtedly has a huge economic impact.
Yeah.
Because if you're really left with long-term complications of your cancer care, that has very significant impact, potentially that might shorten your survival, decrease your quality of life, and certainly can lead to dramatic expenses that may well sometimes exceed that of the cancer care itself.
So it sounds like it has more efficient, lower cost, and improved health outcomes and the patient experience overall. That's
Yeah. And as you can imagine, when you avoid those pitfalls that we described, you wind up with a patient who is much happier with the care they receive. Also, when they have that distinct care team that's well integrated, they're much more engaged in their care and have better outcomes.
Okay, thank you. What services and treatments do you look to enhance to better meet the needs of people living in San Antonio and South Texas?
So as Dr. Mesa was saying, we have a lot of really exciting things on the horizon. What I'll tell you is there's an overarching theme, which is what we just discussed, this concept of multidisciplinary care integration, sort of enveloping that patient in all the services necessary under one roof to support them through their oncologic journey. So the type of services that we're looking forward to enhancing are things that enhance that multidisciplinary care, but also new technologies. So let's start with new technologies. So we're working on a project right now looking at bringing proton therapy to San Antonio. Protons are just a different type of radiation that is much more precise, able to target tumors much more carefully, and even finesse them when they're adjacent to a really important normal structure like the brainstem or the eye or something of that nature. We would hope that this could happen in the next 2 years with the project we're currently working on. There's only 2 facilities of that type here in Texas at this point, one in Houston and the other in the Dallas-Fort Worth area. So this would be a unique thing for the San Antonio region. Currently, if you would benefit from this type of treatment, you have to leave the region to receive it, which is just a huge burden to patients and their caregivers for that matter. The next thing that I'd like to highlight technology-wise is called an MRI LINAC. An MRI LINAC is a device that has an MRI machine integrated into it so that you can actually receive or you can obtain MRI images rapidly, multiple per second, while you're actually delivering treatment to the patient. What this enables you to do is to see those targets and normal tissues far better than in any other technology we have. Again, this allows us to increase the dose to the tumor while decreasing the dose to the normal tissues, which ultimately results in more cures with less long-term side effects. So that's sort of the other things that we're looking at on the technology front is as we look forward to providing San Antonio with its first cancer-focused hospital, we're looking at bringing bone marrow transplant and stem cell transplant to the region. Those are technologies where one would deliver a dose of chemotherapy, sometimes in conjunction with radiation, that would eliminate the patient's host bone marrow. This would then be replenished with a donor or self. In the case of stem cells, it would be peripherally derived or harvested stem cells from either a donor or the host patient. Or in bone marrow transplants, we're actually replenishing with the bone marrow donors' bone marrow. And this will allow for new new research and exciting developments that currently patients have to exit the market for. The next area is Dr. Mesa touched on a bit, but again, continuing that concept of fully integrated multidisciplinary care, the thing that we do best that's not available anywhere else in this region. This is what NCI cancer centers do, is we take all the wonderful research and the things that Dr. Mesa and Dr. Lathrop talked about, and we bring it to the patients. We bring it clinically, make it clinically relevant for our patients as these large multidisciplinary care teams that are super integrated. And so what are those things? Well, this is the Mays specialty clinic that Dr. Mesa was talking about. The first thing that I'm really proud of is this medical management program, which essentially is a primary care clinic for patients who have cancer. So if you imagine, even though you're diagnosed with cancer, that doesn't mean you quit having diabetes or high blood pressure or these other illnesses. Right. Unfortunately, you don't get a buy. And so what we've identified is that patients who are undergoing oncologic care, who don't see a primary care doctor during that course of care, are much more likely to wind up in the ER or in the hospital. And so we've created this clinic that it has specialized primary care doctors who can help support our patients as they go through their oncologic treatments. And it's integrated right in this building, so that it's within the cancer center. These patients don't have to make extra trips or anything like that. And so we're really excited about that. That started in the last few months. The next thing is rehabilitation, cancer rehab. And we are so excited. We have a team of rehabilitation professionals who have focused on the care of cancer patients. So as you can imagine, as you go through your course of cancer therapy, whether it's surgery, chemotherapy, or radiation, these all have side effects. So how do we get that patient back to their prior full functional life? The best way to do that is to have a rehabilitation professional within the group that focuses on that. So, and even further, we're doing that right under this roof as an integrated program within our cancer center. And this group even does what we call prehab. Prehab is where, okay, we know that certain side effects are going to occur as the patient goes through this, so why not start before those side effects have even developed, or before the patient's even received any therapy, and start anticipating those and giving the patient activities and therapies that'll help to prevent those long-term problems. So that has just been a wonderful addition to the Mays Cancer Center. The Cardio-Oncology Clinic has now achieved national certification or accreditation. It's a group of cardiologists who focus specifically on cancer patients. Again, as you can imagine, certain cancer treatments can have an impact on the heart. So this group screens these patients up front for potential problems, follows them as they go through their care, and then, God forbid, if they need an intervention, we're here to provide it. Again, provided right here as part of the multidisciplinary integrated care that we provide. And then finally, one area I'd like to highlight, and there are others as well that we won't talk about today, but that's the survivorship program. And Dr. Mesa did a great job of lining that out. But basically, as he points out, the vast majority of our patients go on to live cancer-free. And so to provide them with the best path forward that's going to provide them the least chance of recurrence and the best chance for a long, full life is really important. And so we're developing a survivorship clinic that'll make sure that these patients are followed long-term and are provided with interventions and surveillance that'll allow them to lead the longest full lives that they can.
It's fantastic. There isn't currently a hospital dedicated to cancer in San Antonio. We hear that you're going to change that.
Yeah.
So tell us more about that.
This is something that we could not be more excited about here at Mays Cancer Center. If you think about it, as the 7th largest city in the United States, I would argue we're unique in not having a cancer hospital, not having a hospital focused on cancer. So UT Health is so excited to be able to make this investment in our community. So what's the vision of this hospital? Imagine all the things that we've talked about today. all the different aspects and this recurrent theme of integrated care, of people working together, people collaborating. So what if you coalesced all that into a single facility that was specifically designed, that every detail was created to facilitate these activities and patients' access to that care? That's what the vision for this hospital is. It's going to be an amazing place. It's going to expand the services that we currently can offer, the research opportunities that we can offer, and again, it's going to just really further that multidisciplinary integrated care that I've been talking about and that the others have as well. So we couldn't be more excited about it.
What year is it?
So it's a 144-bed hospital, about almost a $500 million investment. We'll have 150 new training positions for residents and 750 highly skilled staff positions, and which should be opening late 2024.
Okay, we'll look forward to see that. Thank you, Dr. Bonnen.
Can I just want to add one thing to what Dr. Bonnen was saying about the integrated care, and might be interesting to your readers. We haven't talked much about technology, but the medical record that we have here is a large medical record. It's called Epic. But what I think your audience might really be interested in is how that creates one integration, but connectivity for the patient to their care team. So we have a very high percentage of our patients that interact with us through the medical record directly, and we carry this medical record now around in our pockets because it's on our phones. So my nurses, Dr. Bonnen's staff can reach out to me, or Dr. Bonnen can message me through that system, so that there's this constant integration of information. If I see a patient of Dr. Bonnen's in clinic who's having a problem, I don't have to call an office line, call his cell phone. I just shoot him a message through the system.
Find the chart.
Yeah, and the patient has access, which I think this is very important. The patient has access to their information whenever they want it. So if they are going to another care provider, or they happen to end up in an emergency room on vacation, they can pull up all of their information. They can share their records, their entire medical record, with another medical staff right on their phone, so that all of that value you get with decreasing repetitive tests, but also just having the information another physician needs to care for that patient at that time. I think that's really valuable, and patients really like it.
Dr. Mesa, you have anything to add?
I would definitely echo the excitement. You know, the ability to bring all of this together in this new hospital for this community is really tremendous. I think for all the reasons that have been stated, it will not only integrate really how we're caring for individuals, and again, with every last detail, both architectural and workflow, really focusing on the cancer patient, but it really will then help to support how do we advance how we care for patients in the hospital. The hospital piece of cancer care is rapidly evolving every day. There are some things that are continue to evolve to be shorter stays or outpatient. There's other new complex therapies that are evolving. There's the platform for being able to deliver really cutting-edge innovations in terms of how we provide surgical care, how we image the patient during surgery to really help advance that through artificial intelligence technology and other pieces, as well as clearly, novel therapies through clinical trials. This potential really almost revolution of new therapies that leverage the immune system to go after the cancer, will continue to evolve, and we hope in the future will make some cancers that historically have not been curable, hopefully be cancers that we can now cure. So this is really being designed not only to be state-of-the-art for 2024, but is really as a platform for how do we really move into that next era of cancer therapy.
Thank you.
Yeah, one last thought that I'd like to put forth, and similar to Dr. Lathrop's experience growing up, I grew up in a smaller community that didn't have a lot of these resources. And I would say that one of the overarching goals of this group here at UT, but also certainly a personal mission of mine, is that no patient ever have to leave this region for the best care possible. And that's what this mission, being an NCI Cancer Center, creating this hospital, that is what that's all about.
It's fantastic that we're very fortunate. Well, it looks like we're out of time. I want to thank our speakers again for your amazing insights today during our discussions. As we heard today, UT Health San Antonio has a clear mission to decrease the burden of cancer in San Antonio, South Texas, and beyond. To summarize some of the highlights of today's discussion, the Mays Cancer Center, home to UT Health San Antonio in B. Anderson, patients have a team of experts beside them to make things a little easier during a difficult time in their lives. The Mays Cancer Center is the only National Cancer Institute designated cancer center in Central and South Texas. Has expertise in many areas, many types of cancer. It has advanced treatments such as robotic surgery and immunotherapy. Some of the benefits of this type of care are streamlined treatment pathways and reduced duplication of services and appointments, improved coordination of care and patient satisfaction. UT Health researchers are changing the way doctors across the country detect, treat, and prevent cancer. Their primary focus lies in addressing the care needs of people in South Texas. The research specialties include cancer drug development, meaning you may be among the first in the nation to receive the latest therapies. From the millions of dollars invested in research and continuous commitment to quality patient care, UT Health's impact in our own community has created thousands of jobs and adds billions to our local economy. Bottom line, everyone living and working in Central and South Texas are extremely fortunate to have UT Health in our backyard fighting for our lives. And finally, I'd like to say thank you to our viewers for watching and or reading today's program. Please make sure you visit mayscancercenter.org to learn more about the Mays Cancer Center. And thanks again to all of you. Please enjoy the rest of your day. Thank you.
Thank you.
Thank you. Thank you.